Idiopathic scoliosis is a type of scoliosis that usually occurs in adolescence. We're not exactly sure why it happens, but it involves development of a three-dimensional deformity of the spine. The most obvious is when we're looking at someone's back, it has an S-shaped curve, but it also involves a lot of rotation of the spine, creates a significant asymmetry in their torso, in their ribs, and so it's a deformity that, if not treated early, can progress into adulthood and cause significant morbidity. Kylah came to us for just basically to get cleared for being able to go back to sports. In her case, she happened to have the diagnosis of having a pretty significant curve that was at risk of progression into adulthood. So I had to kind of break the news to them that her curve was severe, and if we didn't treat it surgically, it would lead to problems down the road. Kylah's x-rays from before surgery showed a big thoracic curve, over 55 degrees of curvature of the thoracic spine. We're not just looking at the degree of curvature, we're looking at how much rotation there is. There are x-rays that we do from the side as well that shows another plane of deformity where there's flattening out of the thoracic spine. Once those curves reach 50 degrees or over, the risk of progression into adulthood is pretty high. The x-rays afterwards highlight basically not just straightening out of the curve, but if we look at the x-rays from the side and you look at the x-rays from the back, the x-rays show that we've restored her spine not just in one plane, not just correcting the S-shaped curve that we see from behind, but also restoring her balance of her alignment from the side and correcting the rotation of her spine. So Kylah is a very energetic young lady. She has a passion for cheer. So her biggest concern was, am I going to be able to get back to doing cheer? And we recognize that, and we don't treat every patient the same way. We recognize their athletic ambitions. In Kylah's case, we recognize that she's a very motivated young lady who wants to go on and continue cheer later on in school and also college. And so we talked about that, we discussed that, we tried to connect her with other patients who have gone through the same thing. And it helps the process of going through the surgery and the recovery. And as we can see, her ability to get back to where she was before surgery.